There's a lot of research and support for people that struggle with suicide. Today, I want to share with you some topics and some ideas from the Mayo Clinic and the Nevada Division of Public Health that has given me some ideas on suicide that I use daily. Here are some of those myths and facts. Myth number one: people who threaten suicide are just seeking attention. Now, the fact is, suicide attempts must be treated as though the person has an intention to die. Do not dismiss the suicidal attempt or thoughts or their feelings as simply being attention getting devices. It is likely that this person might be trying to get some attention and it should be addressed. The attention they may ask for could save their lives. And number two, if a person attempts suicide and survives, they will never make any future attempts. Now, the fact is, a suicide attempt is regarded as an indicator of future attempts. It is likely that the level of danger will increase with each future suicide attempt. But number three, teenagers and college students are the most at risk for suicide. Now, we know many different groups have suicidal attempts, whether that's dentists or law enforcement officers or college students or elderly or veterans. But the fact is, suicide for teenage groups and college groups is below the national average. The suicide risk actually increases with age. The age groups with the highest suicide rate in the US is men and women between the ages of 45 and 64. Myth number four is once a person thinks about suicide, they will forever think about the suicide. Now, the fact is that most people have some kind of suicidal thoughts at some times in their life, kind of passing thoughts. But sometimes people struggle at a deeper level. Now, if you're given the proper assistance and support, many people will probably recover and continue to live meaningful and happy lives without having thoughts of suicide. Myth number five: suicide is hereditary. Now, the fact is, although suicide can be overrepresented in families, attempts are not inherited. Now, do not dismiss you have a family or friend that has committed suicide. It is an important risk factor to think about. But number six, a marked and sudden improvement in the mental state of an attempter following a suicide crisis or a depressive period signifies that that risk is over. And the fact is, the opposite may be true. In the 3 months following an attempt, a person is at most at risk for dying by suicide. The apparent lifting of the problems could mean that the person has made a firm decision to die by suicide and feels better because of this decision. But number seven, only certain types of people become suicidal. Like I said, the fact is, everyone has the potential to be suicidal. The evidence shows that some people with conditions may lead to more suicidal attempts. For example, people that have conduct disorders, depression, substance abuse, a lot of pain or anger, they may have some rejections or some feelings of rejection or some rage. They may die by suicide. Myth number eight: talk therapy and medications don't work. Now, the fact is that treatment with therapy and medications does work. One of the best ways to prevent suicide is by getting treatment for mental illnesses such as depression or bipolar illness or substance abuse or learning. People just need to learn ways to cope with the problems. I recommend a combination of both of these when people are coming to me for treatment. Now, finding the best treatment can take some time. It can take time to get the right treatment. And generally it'll reduce the risk of suicide. If a friend or a loved one talks about or behaves in a way that makes you believe that he or she might attempt suicide, don't try to handle the situation alone. get help from trained professionals as quickly as possible. You may be the one that needs to take them to the hospital and get them the help. Encourage people to call the suicide hotlines in your country. If you're finding any value in this, please share this video with someone else. It'd be awesome if you left a comment, maybe type 1 if you found any value here. It really helps me out a lot to know what I should continue to do in these videos. Myth number 9. Most suicides occur in the winter months when the weather is poor. Now, the fact is, seasonal variations do affect people's moods. And yet, it seems that many teens are more suicidal in the spring. And I know that my younger brother died by suicide in the spring. Now, lots of family members may have difficult times in the winter and holiday months. That's true. And many people suffer from depression, have a difficult time in the winter months. According to the Center for Disease Control and Prevention, CDC, in the United States of America, suicide rates spike in the spring and in the fall, not around the holidays as many suspect. The suicide rate is in fact the lowest in December in the United States of America. Myth number 10, every death is preventable. The fact is, no matter how well-intentioned you are, or alert, or diligent in trying to help other people, there's no way of preventing all suicides from occurring. In review, just pay attention to the warning signs. These are some of the warning signs that I recommend. If there's been a recent suicide in someone's life, pay attention to this. Maybe a death of a family or a friend, pay attention to this. If they've had any previous suicide attempts, if they have some preoccupation with themes of death or expressing suicidal thoughts, if there's a lot of depression or conduct disorder or problems with adjusting to things and they're abusing substance abuse, particularly if when they're doing a few of these things at the same time, pay attention to that. If they're all of a sudden giving away their prized possessions or making a will or some other final arrangements. Maybe they have some major changes in their sleep patterns, maybe too much sleep or too little sleep, or they have some extreme changes in their eating habits, maybe losing too much weight or gaining too much weight. Or they might start withdrawing from their friends or family members, other behavioral changes that you see. They drop out of activities that they've liked, drop out of school. Maybe they have some personality changes, such as being nervous, or maybe all of a sudden outbursts of anger, or impulsive or reckless behaviors that start happening. Maybe they have a lot of irritability or some unexplained crying a lot. They keep talking about how unworthy they are or they're a failure. Maybe they don't have a lot of discussion or interest in the future. Look, therapy can help. Asking people this if they're suicidal is not going to cause them to commit suicide. Ask people how they're feeling, what they need, and help them. Pay attention. But it's not your fault if someone commits suicide. Look, I want you to become a trial tapper. People that find hope, resilience, and post-traumatic growth after life's trials and traumas. I want you to help those around you. Hope is possible after all trials and traumas. If you want more mental health tips, check out this next video. See you next time.